Hi there, and thank you for joining me for today's live Q&A session. My name's Rebecca. I'm sure many of you have joined me on one of these sessions before, but if it's your first time, then just to explain the format of today's session, I'm here for the next 60 minutes to answer any questions that you may have about preparing for OET. And what I usually start off by asking is which test you are preparing for. So here we go. This is going to come up onto your screen. Which test are you preparing for? Are you preparing for August, September, or October? And that just gives me some idea as to how far in advance candidates are preparing for the test, because obviously careful preparation will lead to the greatest chances of success on test day. So if you'd like to let me know which version of the test you are planning to take. We've got some early people coming in here for August. Now some also coming through for September. So that's good. That means we've got some people who are nearing their test day and others who are still a little bit further away. So as I was saying, for the next 60 minutes, I'm here to answer your questions about the test, any part of the test, so any for skills, reading, listening, speaking, or writing. I'm happy to answer questions on any of those. And I will just get through as many questions as I can in the next 60 minutes. So as soon as you have a question you'd like me to answer, please type it into the comment box and I'll get started on those. And then after the hour is over, you can watch a recording of this video. So if you're unable to stay for the whole session, then it's good to watch afterwards to get those questions answered. So thank you for telling me which test you are taking. We've got some candidates online now who are taking or planning to take one of the tests in the next 3 months, but most are at the moment online for the August test in a couple of weeks. So here's a question coming in from Ibrahim. Are we going to send a letter to family members or not? So this is a question that we've had quite a few candidates contacting us about recently. What kind of letter different professions may have to write. And the best place for me to refer you to answer that question is to our website, because we have very specific information about this on our writing page, which I've just posted in the comment box right now. And this explains, depending on your profession, what type of letter you may be expected to write. For most cases and in most professions, it will be a referral letter, but something like a letter to a family member is only seen by a small number of professions. For example, it might be pharmacy or speech pathology. Doctors and nurses are not going to be writing letters to family members. So do check out that link to read specific information for your profession and to clarify which type of letter you may need to be prepared for. But good question, and as I mentioned, quite a lot of candidates have been asking that recently, so really good to get that information clear. Vardeep is asking about strategies for the speaking test. So the speaking and writing tests are profession specific. And for this part of the test, for speaking, you will complete 2 role plays. Now, the 2 role plays that you are given are likely to be quite different. It could be that you have one role play task, which is quite a routine event. For example, if you're a nurse, it might be to give them some lifestyle tips and advice about perhaps hypertension, living with diabetes, something like this. But then your second role play task could be something where perhaps the patient is feeling quite emotional, or perhaps the situation is more urgent. And the benefit of having 2 quite different role play tasks is that it allows you to demonstrate a variety of English. and to show that you can use language that is personalized to the situation, because of course this is a really important skill for a healthcare provider to have. It's one of the huge benefits of OET as a test for regulators, that by taking OET they know that you have demonstrated this variety of language and you're able to talk to patients in a way that is suitable for the test. So that's definitely one of the strategies that I would think about when preparing for the test, is to make sure that you approach those two role play tasks differently. Don't try to use the same language for both role play tasks. Try to make sure that you imagine this is a real patient. Put yourself in a real situation. So rather than thinking that this is a test, think that this person sitting opposite you is a real patient. They're not a healthcare professional. On test day, the other person in the room, which we call an interlocutor, is not a healthcare professional. So they are able to take quite authentically the role of a patient, and they will have concerns, they will have anxieties, and these are the things that you need to talk about and discuss during the role play, depending on the information that's on your card. So my second strategy would be to pretend or imagine that this isn't a test situation, this is real life. And if you talk to the interlocutor in the test room as you would to a real patient, you show concern for their anxieties, you allow them chance to explain the situation to them, you listen and respond to what it is you're telling them, then that's going to be the best way to get a good score for the test. Vishnu says, is an article needed for procedures like colonoscopy as well as tests like UCG and CT scan? So this is a question about article usage. So articles are a, an, and the. Those little words that cause a lot of problems for many candidates, because in most other languages they don't exist. So I really appreciate why candidates struggle with article usage. Now, there are a few rules that you can learn, particularly in healthcare situations. And one of those rules is with tests and medical diagnostic kinds of processes. An article is most often used, particularly for things that are countable. So something like a colonoscopy or a CT scan, patients can have many of these in their lives. They're countable. So definitely this kind of test will use an article. But then conditions or names of diseases are not countable. They are not used with an article. So words like cancer or pneumonia, you don't need to use a or an with those. So hopefully that's a couple of good tips about article usage. Soraya is asking about guidelines for writing, especially introduction. Is it necessary to put the word refer in an introduction? Good question, Soraya. As I mentioned in an earlier question, for most candidates, you will be writing a referral letter, but it isn't always necessary to write the word refer in the introduction. There are many different reasons why we might be referring a patient, and sometimes you can use a different verb instead of refer to be more accurate to that situation. It may be that you are requesting something. For example, you might be requesting a second opinion, in which case to mention that in the introduction, to say you are requesting a second opinion, could be a good alternative to the verb refer. So refer is a perfectly adequate verb if it is a referral letter that you are writing. But don't forget that there are other verbs that work in a healthcare situation that might be more appropriate, and try to choose the one that is best suited to the situation you're writing about. Rubina says, is grammar important in listening, for example, singular and plural? So Rubina, for the listening test, I think you're referring to listening part A, which is when you are completing notes about a consultation, 2 consultations, in fact, that you are listening to between a healthcare professional and a patient. And the good news is that in listening part A, the assessors are quite flexible with your grammar and also with your spelling. So they're not looking for perfection. Really, they are just checking that you have understood what is the answer and you have been able to write that down. Now, if you're missing off the plural S, for example, or you haven't spelt the word 100% perfectly, but they can still understand that that is the correct answer, then they will mark you correctly for those answers. So that's good news. That's reassuring. Chantal is asking, where does the word count start in writing? So Chantal, this is a common question about how many words to write in the writing test. And you will all be familiar, if you've had a look at one of our sample writing questions, writing papers, that at the end there are a couple of instructions, and one of them is to write around 180 to 200 words. And what they say is that the body of the letter should be within this kind of word limit. Now, the body of the letter are the paragraphs that you write. So anything above the paragraphs, the address, the RE line, the dear, the greeting, this isn't part of the body. Anything below those paragraphs, the ending to your letter, your job title, that's not included in the body. So it's only the paragraphs that are included in that body count. But just to remind you that it's there as a guide. It's there to give you a rough idea of how many words that should be included. But the assessors will not count your words, and therefore nor should you. There are better things that you can be doing if you have some free time at the end of the writing test. For example, checking the accuracy of your grammar, making sure you have included all of the relevant details into your letter rather than counting words. So the body of the letter are the paragraphs. But if you have chosen the information from the letter correctly and omitted anything that is irrelevant, it's likely that you will end up with a letter that is within those guidelines anyway. So it's not something to really focus on too much. A couple of other questions from Chantal. Is it okay to copy the abbreviation from the case notes in writing? So this is really a choice that you need to make. Abbreviations are informal and you are writing a formal letter. So our advice is really avoid using abbreviations unless the abbreviation is much more common than the full form. Or perhaps that it's so standard for someone in your job role to use that abbreviation when writing to the person receiving that letter. But I wouldn't be using a lot of abbreviations. Otherwise, it's likely to affect your score for the criteria, genre and style, because you will end up with what looks like quite an informal letter when the task is to write using formal language. I've answered a very similar question about listening. So your final question, in reading, is it okay to underline the questions for keywords? Absolutely. And that covers any part of the test. That test paper is yours to do with what you like during the test. So in any part of the test, you're welcome to underline or circle information as you like. Just make sure that it's really clear to the assessor what your final answer is. And obviously in the writing test, you cannot do any kind of underlining or circling in the first 5 minutes reading time. Hafiz says, should we write the current presentation just after the introduction in the new criteria? So Hafiz, the recommendation that we've actually always provided for the writing test is that when starting the letter in English, it's very common to explain the reason for writing. And then in a sort of healthcare letter, to explain to introduce the patient.